beautiful bill. This is also a live Q&A, so a lot of people have questions about it, how that's going to affect their Social Security benefits, their retirement benefits, their Medicare benefits, their Medicare Advantage plans, Medicaid, and all the rest of it. So we're going to get into 5 things. I always like to throw out an extra, so I've got 6 things that you need to watch out for immediately. Even though some of this stuff doesn't take effect immediately, it's timed over several months and several years. Usually when politicians do this, they always do it after the election season, the most, the most negative stuff until they pass the election and get back into office so they can get all the money from their supporters and all the rest of it. Then this is no different. All right, so let's go ahead. And so if you have any questions, make sure you type them into the chat there, and I will get to as many as I possibly can. Okay, so what are we looking at here? One thing that's definitely that people need to take action immediately. If you are on a Medicare Advantage plan, because Medicare is part of the pay-go, and people are going to say, okay, there's no changes in the big beautiful bill about Medicare. That's correct, but part of sequestration, I don't want to get too in the details, but it's a pay-go system. It was a law that was passed in 2010 that if the government, Congress passes something that causes a deficit, there has to be automatic cuts. And these automatic cuts are going to come starting January 1st. So if you have a Medicare Advantage plan, it looks as though the benefits that you're going to receive for 2026, I know there's Medicare Advantage, all the Medicare Advantage plans, companies, health insurance companies throughout the country are working 24/7, and they're redesigning their plans based on this new reality of how much they're going to get or not get next year. And so they're going to start cutting benefits. So in anticipation for that, and you should have done this anyway, people on Medicare Advantage plans should do this anyway. In anticipation for that, you need to start using your benefits now, this year. And the CMS, Center for Medicare and Medicaid Services, knew about this about a couple of years ago. They started to change this, and you're supposed to be getting a letter. If anybody's gotten a letter out there, make sure you type it in the chat there or in the comments and say, hey, Ed, I got a letter from my Medicare Advantage plan, and it said, I have dental of this much, I have vision of this much, I have hearing of this much, I have gym membership of this much. And just kind of FYI, that is a brand new letter that Medicare Advantage companies are required to send out to you in July, August or so. So those letters should be coming if you have a Medicare Advantage. And the reasoning is because, the companies would sign you up and they would entice you with, bells and whistles and free ice cream and unicorns and stuff like that. And you say, okay, I'll take this one instead of this one. You should always focus on your health first and prescriptions and saving money, but those extra benefits are extra benefits. So you signed up for this one, but then the government said, a lot of people aren't using the dental and vision and hearing and gym membership. We only use our gym membership for, January 2nd, I think we stopped using our gym memberships. But anyway, that's neither here nor there. But the government said, is it because you're making it difficult for these people to, in your plan to, access those benefits? Do they not know about them? So to solve the whole maybe people don't know they have dental or vision or hearing or something, we want you to send out a letter. So those are what those letters are going out there. So if you received a letter, let me know. And it should say, here's what you got. If you didn't receive the letter, doesn't matter. Go ahead and call your Medicare Advantage plan, look online, whatever the case may be, and say, I've still got $3,000 of dental. I haven't used any of that dental. I've still got membership of, vision. I can get glasses or whatever. Start using that stuff now. We've got only 6 months. 6 months, happens fast. And then because all that money goes away December 31st, you cannot, roll that over into 2026. You have to use it before the end of the year. Medicare Advantage plans are only good for 1 year. So the plan you have this year, and doesn't matter. Next year, January 1st, you're going to get a new plan. If you don't do anything, if you don't switch, if you don't check it, if you don't review it, you'll get the same plan you are now, but you'll still have the same card and the company name and the name of the plan or whatever, gold or super gold or platinum, whatever it is. But all of the details are going to change. Well, pretty much a lot of them, most of them. So we're going to see if you were getting $3,000 of dental this year, you might get $1,000 next year. If you're getting $1,000 this year, you might get a $500 this year. So we don't know, but use what you got now. That's the most important thing. So call up your company, call up the person that signed you up. If you signed up with the company that we partner with, Chapter Medicare, call them up and they will help you navigate all of that, tell you exactly what you got. Okay, so that's number one action you have to take. If you're out there with Medicaid, we lost the battle on Medicaid. So millions of people are going to get cut off Medicaid, and it's, that's not going to be surgical precision. They're not going to go, that 26-year-old person that should be working and, in the basement playing PlayStation. Okay, they're going to cut that person off. But how this thing is written, unfortunately, there's going to be a lot of collateral damage, and we don't want you to be one of those collateral damage. So number one, you definitely need to reach out to the state, whatever your particular state calls Medicaid, Medi-Cal, Denali Care, whatever they call it. Reach out to them and make sure they have your updated address. Because if you moved or something like that, they don't have the right address. They send you the forms. Prior to this year, they would say, hey, what's going on? Help you a little bit. And there was actually a law that was supposed to take effect that they were supposed to help you a lot. But the big, beautiful bill rolled back that law and basically has said, no, we're not going to help you at all. If you forget to check this box or you forget this form or you're a day late, then sorry, you're done. You'll have to go over and go through the whole process again. So it's called paperwork purge, and that's going to be happening out there. So we want to make sure that doesn't happen to you. Since we lost the battle on that nationally, Congress has decided they want to kick millions of people off of Medicaid. There are going to be states that are going to take a preemptive strike, and they're going to say, hey, we're looking at our state budget for next year. It's going to be cut a lot from Medicaid. So we're just going to go ahead and start doing stuff now. We're going to start, making it more difficult for people to get Medicaid, to keep Medicaid. We're going to, cut back on particular doctors. We're going to cut back on funding. We're going to make, it was 138% of the poverty level. Now it has to be 158% of the federal poverty. They're going to do all kinds of different things. The states are going to try to save money, and they're going to start doing that immediately. So make sure you reach out to your state politicians and say, don't try it. If you don't have Medicaid, there's probably people around you that do. So let's look out for those people and, make sure we take care of our communities. All right. And if you get any letters like this, if people start getting letters about Medicaid, make sure, you subscribe. I'm putting together extra resources to help people navigate the Medicaid bureaucracy so you're not part of that whole paperwork purge. So if you get any strange letters, make sure you come in here and go into my website as well. I've got a few video questions already, but if you go into my website, mygovexpert.com there, you've got tons of resources on Medicare, Medicaid, the retirement, all the rest of it. But on the bottom left, there's a little, an icon, a little camera, and you can go in there and record a video and just say, hey, I just got this letter and it says this, that, and the other. And then we'll come up with a plan of attack, because if you got it, there's probably thousands of other people that got it too. So we're going to try to see what we can do to make sure people keep the health care that they need. And, okay, the next thing out there is local hospitals. We've already seen one hospital in Nebraska decide to go ahead and shut down, and they said they're shutting down. They've been barely surviving. But based on, the big, beautiful bill and the cuts to Medicaid, they said, yeah, that's the final, that's it. That's the final straw. So they're going to go ahead and close down. And we're going to see a lot more of those. But the big thing is private equity. So there are going to be hospitals that shut down because less people are going to have Medicaid, fewer people are going to have Medicaid. And then those hospitals, people are still going to get sick and get injured and stuff like that, and they're going to go to their local hospital. And the hospital's, going to get stuck with that bill. And so it's going to put a lot of local hospitals in dire straits. So number one, reach out to your local hospital, make sure they're viable, make sure they're good. Say, hey, if, How many people in our area go to your hospital, you know, from Medicaid, and ask them, says, how many people do you think are going to lose Medicaid? And are y'all good? Am I going to lose my local hospital? Are y'all going to shut down? And here's the thing, private equity being sucking up hospitals throughout the country. So it's just a bunch of people with a whole bunch of money, and they go around and they look for, you know, dying businesses, and they swoop in like vultures and they buy it up, and they give you all kinds of great stuff. Oh, we're going to make it better. We're going to do this. We're going to put a, you know, lipstick on this pig. But what they want to do is they cut back staff. They make it look profitable. And this is, so after about a year, they say, yeah, look, your hospital is finally profitable. And then they sell it to some other sucker. And what it is not necessarily profitable. They just cut back on staffing. They cut back on maintenance. They cut back on, you know, updating the new MRI machine or CT scan or whatever the case may be. So, and then you eventually have to pay for it, or they sell off the land because the land's worth more. And before you know it, they sell it, they're gone, and you never hear from it again. That's a common thing that's happening throughout the country. So watch for private equity. And there's some areas of the country that have fought these private equity people from coming in and taking over the hospitals, and they've won. So reach out. And so if you have a local hospital, reach out to them and say, hey, are y'all good? If not, then you need to contact politicians and say, hey, you know, we need to do something about our local hospital. And if these vultures start knocking on the door, y'all need to get joined together and make sure that doesn't happen. Okay. All right. Next thing, a lot of questions about this whole called Social Security email. Wow. That is if you ask me, my personal opinion, I'm not a lawyer, but that's an illegal email that was sent out. Yeah. The federal government should have not been. That is a campaign email, supporting a particular political party. That is a violation of the Hatch Act and so many other, yeah, that's just, and above and beyond that, it's incorrect. You're still going to have to pay taxes if you've been paying taxes, you know, income taxes and stuff like that. It's basically a deduction, a $6,000 deduction if you're single, $12,000 deduction if you're married. And the people higher incomes, those are the ones that are going to get the benefit. The rest of the 40 or 50% that are just barely, you know, just living on Social Security and you know, some other small little income, it's not going to affect you. Zero benefit for you, because check last year and your income taxes for last year. And if you're under the 40, 50% of people, you didn't even pay taxes on your Social Security benefits. So this $6,000, no, it's not a $6,000 stimulus. So you're not going to get $6,000 back from your taxes or anything like that. Yeah. If you're the 40, 50% in the lower income, then this doesn't affect you at all. What it does do, it hurts you, unfortunately. How it hurts you is it hurts everybody, because the Social Security Trust Fund, this is the issue. So this is the new numbers for the Social Security Trust Fund. So basically, this much comes in to Social Security every year from FICA taxes, $1.2 trillion in 2024. That much goes out. Total cost is $1.3 trillion. So we're looking at about $100 billion deficit of what came in versus what goes out. What covered that deficit? The trust fund. So money was pulled from the trust fund to cover y'all's checks, okay? About 10% or so. But you'll see this number here, taxation of benefits, $54 billion. So $54 billion came in from people paying taxes. And yes, I agree. We shouldn't have to have paid taxes on Social Security from day one. That started in the 1980s. I agree. But the fact is, the top 40, 50% are paying taxes on their Social Security benefits, and that money goes back into the trust fund, about $54 billion in 2024. And if that money's gone, that means the trust fund runs out sooner. So this year they're talking about 2033. Now it's, if because of this no taxes on Social Security, then we're talking probably about another 6 months or a year earlier and a higher cut on our Social Security. So people think in the lower 40–50% of income brackets, they think, oh, great, $6,000. This is awesome. It's going to make my life so easier. No, it's not going to help you at all, number one. And number two, it's going to hurt you more because you're going to, the people that are only living on Social Security, your benefits are going to get cut more once they start cutting in the future, because this income is no longer coming in. And if you're also looking for retirement or something like that, there's 11,000 people that turn 65 every single day. And people are wondering whether you should go ahead and file for benefits now or later or whatever the case may be. And then again, on my website, where's my website here? On my website, it has a retirement calculator. So if you're new, you can when to start, application process, working and benefits, taxation, all that kind of good stuff. But I have a little calculator there. It gives you kind of an idea of, kind of a graph, so you can figure out when you should pull the trigger and start receiving your Social Security benefit. So that's 100% free, so make sure you check it out. All right, and the very final thing is, it's not really part of the big, beautiful bill, but there's a lot of social media stuff out there is talking about Social Security benefits are going to be cut by 50% for millions of people. Come on, social media people, stop it already. What it is overpayments. Before Elon Musk and Doge came in, if you had an overpayment, they will withhold 10% automatically. Elon Musk and Doge came in, the new administration came in and said, hold my beer. We're going to take 100%. And then we and everybody else just, said, no, that's crazy. So they went back to, well, they didn't go back. They said, okay, we're just going to hold 50%. So if you have an overpayment for whatever reason, you work too much, you're no longer disabled, whatever the case may be, then they're going to hold back 50% of your benefits automatically. But that's just temporarily until you reach out to them. So on my website, if you go into the more part there, I've got a section on overpayments. So all those people out there, and it talks about what I just said. If you get an overpayment letter, don't freak out. They're not going to hold 50% forever. You just have to, they're going to hold 50% until you reach out to them and make a better deal, which you will. So here's what you do. You pay it in full, request a waiver, and then it gives, my website gives you an overview of what the difference is between a 561 and a 632, request a reconsideration and a waiver and all the rest of it, your appeal rights, and it gives you all that information. 100% free, so make sure you check it out if you get an overpayment. And if anybody in your family gets an overpayment, again, remember, we have the best community on the internet. In social media land, we are number one, and that's because we look out for each other. So please reach out to those people that are having issues with Medicaid, Medicare Advantage, overpayments, anything like that, and make sure they do the right thing, because it doesn't look like, of the people, by the people, and for the people government. Yeah, not so much. Okay, let's go ahead and get into some questions. If you're just here for the topic of the day, then have a great day. Awesome. But the bunch of people are going to stick around for the next 40 minutes and ask questions. The reason I said that is I pretty much every day I get comments. I said, Ed, you're such an idiot. You expect people to listen to you for an hour? Come on. Well, the first 5 or 10 minutes about the topic, but if you want to listen to people's questions, then yeah, stick around. So, all right, I'm not going to stop answering people's questions. So, regarding Florida Entrepreneur, what's up, Florida? Regarding Medicaid, there are a lot of people that sit at home, play video games, and should be out working a real job. The bill is the best bill ever passed. Yeah, there's people like that should have health care, whether it's Medicaid or Affordable Care Act and stuff like that. But yeah, you have a lot of faith that the politicians wrote this thing perfectly, and you have a lot of faith in the government that your local office, who is completely understaffed, is going to execute that thing perfectly. So, yeah, you have a lot more faith in the government in the process than I do, and than most of us here. So, yeah, wow. I'm right wing, but right wing YouTube got folks saying kick all with 9 kids off Medicaid, like that is the whole population. They're very cool and politically propagandized. Yeah, yeah, people's lives out there are tough, and so you know they that's the first thing people do is they try to raise themselves up by lowering other people. That's yeah, unfortunately. You bet, Tony. No guarantees, but if it happens in the worst way, then you make yourself some new friends. Okay, so someone's having a conversation here. I don't read these before I pop them up. So they're hurting the poor who doesn't file taxes. Yeah, there are people ask me all the time about tax type stuff, and I don't do taxes. I never work for the IRS, but I've got on my website, I've got a link on the taxation part of it. I think it's still there. For on the retirement thing, I've got the taxation of benefits and individual filers. If you're up to 25, if you're between 25 and 34,000, you can pay up to 50%. Tax is taxable. You're not paying 50% tax rate. It just says up to 50% is taxable. And then this is a great little benefit taxation estimator. You click on that, it takes you to the IRS website, and then you can check out how much your benefits will be taxed if they are. But what's interesting is now, again, they're still going to be taxed, but you're going to get that $6,000 to $12,000 deduction. But it's only going to be for what, 2 or 3 years. It's a temporary thing. All of the stuff for the regular people is temporary. No tax on tips, which the details are interesting. All of that's temporary. The tax cuts for the rich, those are permanent. Yeah. So, Debbie, I'm on SSI. Can I collect on my husband's Social Security when I turn 62? He is on SSDI. Not only can you collect on his record, you have to collect on his record. So if you're on SSI, supplemental security income, then as part of that, you have to apply for any benefits you're eligible for. So at 62, you're eligible for spouse benefits. So you have to file. So and you could also be eligible for benefits on your own record if you paid at least, into 10 years, 40 quarters. So what will happen is when you turn 62, you'll probably receive a letter that says, hey, you're on SSI and you're 62, you need to go ahead and file for retirement benefits. And it's basically an offset type thing. So if you receive, let's say you receive $967, which is the max for SSI, and then you receive $200 from your own record, and then $300 from your husband's record. So that's $500 total. What they'll do is they'll take $500 off of the SSI check. So you get $500 from retirement, yours and your husband's, and then the other $467 from SSI. So, and then because I'm not sure if you have Medicare, you won't. Yeah, you won't be eligible for Medicare until you're 65, unless the state is paying for your Medicare or something like that. So let's see, when PayGo kicks in, how are they going to take that $500 billion from Medicare? Are they going to raise our Part B payments? That's the question. That is the question. And what he's talking about is that PayGo, there was no suspension of this. So in a earlier version of the big beautiful bill that was in the House, they said no, we're not going to do that, and then they took it out. Did a night or something, whatever the case may be. But now it's automatic cuts, about $500 billion over 10 years. So they can only do a 4% reduction year over year, but 4% total across the board. So that doesn't mean, oh, okay, I can deal with 4% less on dental or vision or something like. No. What they do is they, look at the low-hanging fruit and they say, okay, we'll cut that one out completely. And then we'll cut this one out 75%, and we'll cut this one out 50% to come to the 4%, total part of the budget. So there's no telling exactly what they're going to be cutting. But probably the, Medicare Advantage plans, how they make more money is, charging extra for specialists, charging extra for a night in a hospital. They usually don't raise the premiums. Right now they're at 0 because they want to get you to sign up, but but then on the back end, when you actually use it, that's when you have to pay, $100 for a hospital per night, or maybe $200. So next year they might go $200 or start charging you more for your prescriptions. And the hospitals, they might start restricting the network. Like, this hospital is getting too expensive, so we'll go to this cheaper hospital over here. So yeah, I'm going to keep an eye on all this, and we won't know. For the Medicare Advantage part of that, we won't know until October 1st. So you can, if you definitely need to check this year. So you can reach out to chapter anytime and say, hey, put me on the list for October. And you have from October 15th to December 7th to change your Medicare Advantage plan, to review your Medicare plan and change it. The new plans come out October 1st, but you can't start changing it till October 15th. So you can reach out to chapter or whoever you want, and start that process and say, hey, put me on the list to check. Mary, is QMB MSP being gutted permanently? I depend on it with my DSNP, and what will happen to PPO? There's a lot of acronyms there. Yeah, luckily I work for Social Security and Medicaid and did Medicare and Marine Corps. It's all about acronyms and government. Okay, QMB, Qualified Medicare Beneficiary Medicare Savings Program, Dual Special Needs Plan. Provider networks. Okay, so basically, yeah, that looks like it's going to take a big cut. What Mary's talking about is these Medicare savings programs. It's basically, if you are receiving Medicare and Medicaid, trying to find the link here, so I'll go over it generally. But if you are receiving Medicare and Medicaid, then the higher levels of Medicaid. So QMB is basically the highest level of Medicaid. So in that level, the state pays for your Part B premium. Okay. But we've got $1 trillion coming out of Medicaid. And believe me, there ain't $1 trillion of 26-year-olds in the basement playing PlayStation. That's not, and people are going to say, well, they're going to kick off undocumented immigrants. No, undocumented immigrants are not eligible for Medicaid, retirement benefits, Medicare. It's just, yeah, that's a thing that politicians tell us to shut us up. And some people still believe it. But anyway, so yeah, there's not $1 trillion of, PlayStation players out there receiving Medicaid. So they need to cut the $1 trillion some other places. And a lot of that money is matching money. So you get money from the federal government, $1 trillion less, $900 billion less. And that is less money coming into the states. So these states are paying for that, for your $185. They're paying for your upper levels of Medicaid. They're paying for all this other type of stuff. And their budgets are going to hurt bad. So Mary, reach out to your state politicians, because the federal government, yeah, they've thrown their dice at us. Reach out to your state politicians and say, hey, I've got QMB. I can't afford $185 a month coming out of my Social Security check. And remember, you have the DSNP, the dual special needs plan, which is for those people with Medicare and Medicaid. You're eligible for that Medicare Advantage DSNP. It's a special needs plan. And you probably getting a grocery card as well, $50, $100, $200. But if they kick you off Medicaid, or if they just downgrade you from QMB to a lower one because they need to save money, then you're no longer dual eligible. Even though you're dual eligible, you're not dual in the higher, you have to be higher level dual eligible, QMB, SlimB, QI. And you just might lose that as well, that $100, $200, $300, plus paying extra $185 for your Medicare Part B premium, plus paying more co-insurance and co-pays. Yeah, so reach out to your politicians. It's Scott from South Carolina. If over 65, get an additional $66,000 deduction for you and your spouse if over $12,000 possible. Yeah, that's an extra deduction. So if you're in the upper tax brackets and you're actually paying Social Security, then it just might help you out. Yep, absolutely. But it's going to hurt everybody in the long run because, again, when is the Medicaid going to be cut? That's Federally, it doesn't take place for a while yet, but again, states, I think, are going to see the writing on the wall, and they're going to see that next year's budget or the year after is going to be terrible for them. So I think some states are going to start taking action. So we need to have some feelers out there. So I've got people watching from all over the country. If you get a letter that says, hey, you are eligible for Medicaid, you pass everything, the income limits, the resource limits and stuff like that, you were good and you were eligible for Medicaid last month. But because of X, Y, and Z, sometimes they don't say it. They don't say because of budget cuts we're going to know. They're just say, well, because of the new numbers, the new thresholds. Sure, you only make $1,500 from Medicaid from Social Security, so you're eligible. But we're going to raise it to now you have to be under 13,000 rather than 15,000 a year or something like that. So they're going to raise the threshold. Yeah, so if you receive any of those, make sure you come back here and reach out. And that way, if you get that letter and you're in Nebraska or Texas or Florida, then we can put out an alert to everybody in Florida and say, hey, Florida, someone just got a letter in Florida, and y'all need to start calling your politicians and say, hey, no, don't even try it. So come up with some other options. Let's see. I did not have an overpayment, but they robbed me for a year anyways until I started talking about court and getting in front of a judge. Okay. So didn't have an overpayment, robbed you. So they didn't give you your benefits for a year, but it sounds like you appealed, you fought it. There we go. I've got an entire section on my website about the appeals process. So you went all the way up to the appeals court. Beautiful. Awesome. Good deal. Wait, I keep 50% of your entire check, not just of the overpayment itself. Yes, they keep, 50% until the overpayment is paid off. And what it was, here's the idea is, again, if you reach out to them and set up a repayment plan, and you can set up a repayment plan up to 60 months, and it's really easy to set up. If you agree with the overpayment, it says, yeah, I work too much, yada, yada, I got paid too much, yada, yada, whatever. And you want to go ahead and set up an overpayment plan, you can do that. Super, super easy, up to 60 months, 0 interest, awesome. So, but the idea is the whole 10%, 50%, all that kind of stuff is they send out a letter and they said, you got an overpayment. And if you call them up and take care of it, then you're good. Say, hey, if you want to go really, really small because you don't have, you can only do like $10 a month or $20 a month, then if you go over the 60 months, then you'll have to provide some financial information and stuff like that. I've done this hundreds of thousands of times when I worked at Social Security. But if you don't contact them, that's when the automatic 50% kicks in. So there's a lot of people out there. So please share, like, subscribe, do all that kind of stuff. There's a lot of people out there that receive that letter or don't receive that letter, and then they get a 50% and they think, okay, well, I guess I can't fight it. No, if you get anybody like that, if you know anybody like that, reach out to them and say, no, you can fight it. You can set up a payment plan. You can file the 632, go onto my website. It gives you all the instructions. It has links to the application and all the rest of it. The waiver, the request for waiver. So you can fight it, just like, who was it? Was it Mary or whoever it was that fought it all the way to the administrative law judge? Yes, you can fight it. Some are so uninformed and limited intellectually. Sorry, but stupid is stupid. Yeah, I used that quote yesterday. Yeah, it's politicians give us the easy answers, and the world is complicated. We want easy answers, but unfortunately, easy answers are not always correct. Hello, Wisconsin. Pray for Donald Roth, military veteran. He had to wait 2 years to get his dentures from the military board. And Philip Roth, please pray for those two men. Yes. Okay. Thank you. If Social Security is cut in 10 years, then Americans need to start cutting by the same amount they pay in taxes, a dollar for dollar deduction against any taxes owed. I feel you. But yeah, I've been trying to cancel my subscription to the IRS for decades, and yeah, they're going to come after you. Good. I don't care about their taxes. I care about federal money going to pay for illegals. Yeah. Again, you've fallen for the political distraction. So you're unfortunately. Have you heard anything about making Medicare Advantage plans the default for Medicare? It's in the Project 2025. Yes. Dr. Oz, if you ever watched his TV show, yeah, he had, Medicare Advantage and stuff. And, the problem with Medicare Advantage plans and why I always, if you're going to sign up for original Medicare, original Part A, Part B, awesome. Make sure you actually have to sign up for it. You don't have credible coverage that you're actually signing up for it, not wasting your $85. That's number one. But if you've got a whole bunch of money sitting under your mattress, then you don't need anything else. But if you don't, you're going to need something else. And I always say, check out a Medicare supplement plan, a Plan N or a Plan G. But if it's not in your budget, then it's not in your budget. So then a Medicare Advantage plan is the best option, rather than having just Medicare alone. So you get a Medicare Advantage, it just takes more effort. You have to check it every year. You have to fight for some stuff. And the two issues with it are networks, limited networks, and those networks are being more limited continuously, and prior authorizations. So you just have to fight for those as well. And on my website, I have got those. If you get a prior authorization from your Medicare Advantage plan, make sure you fight it. So you go to my appeals section there, and it tells you about all the appeals and the Medicare appeals process and Medicare Advantage process as well, the level 1, level 2, level 3 of how to fight it. Your formulary, if you have a particular drug that's not on your Part D or your Medicare Advantage formulary, you can request an exception. If it's expensive, it's a tier 3, and you'd rather have it to be a tier 2, you can do that. So you can fight a lot of stuff. People don't know that they can fight, and therefore they don't, and they just give up, and that's not what we want here. So yes, Project 2025, Dr. Oz has said Medicare Advantage, as the default option when you sign up for Medicare. Okay, I want to be fair. If that's the system they want to use, because I'm, big fan of Medicare for all, but Medicare, there's a 6 gaps. It doesn't have dental, vision, and hearing, and there has to be some public profit, thing in there, because that's how we run as a country. If you're going to use Medicare Advantage as a default, okay. But those issues have to be addressed. Those prior authorizations and those networks have to be addressed. And if those are addressed logically and they work out for the people rather than for the corporations, then okay, we can have that conversation. But if they just say, yeah, Medicare Advantage as it is, yeah, that's no. So anyway, so does the interest deduction on home payment still in effect? Yeah, I'm not sure. Sounds like a IRS type thing. The politicians will never be on Medicaid. Yeah, politicians have that phenomenal. I mean, federal employees have great health insurance. They have to pay for it. A lot of people think federal employees don't pay for health insurance. No, I was a federal employee. We paid for health insurance. But yeah, politicians have even better ones. Anyway. Let's see here. Is extra help going to be cut? That's a good question. So we're talking about the extra help with the Medicare prescription drugs, the extra help, the low income subsidy. People just call it the extra help. I certainly hope not. People, if you lose Medicaid, then if you lose Medicaid, if you get Medicaid, you're automatically signed up for that extra help with the prescription drugs. If you lose it, I don't think they're going to disenroll you. If they do, you just go ahead and re-enroll directly, and you re-enroll through the Social Security Administration. It's one of the easiest Social Security forms there is. Super, super easy to do. I've done hundreds of thousands of them. Simple. And this year, okay, there's a few changes for this year. Last year, the maximum you had to pay out of pocket for a prescription drug was about $8,000. This year is about $2,000. And there's also this thing called smoothing. So if you're you got to $2,000 max and you're like, well, that's fine, but I have to pay $2,000 in January, February, and then I'm good for the rest of the year. But January, February hurts. There's this new thing that's called smoothing. You contact your prescription drug plan, your Medicare Advantage plan, and you say, smooth me. So rather than having to pay, $2,000 in January, you can pay a little bit every month until you pay the entire $2,000 for the entire year. So a lot of people don't know about that, and they're hurting in January, February. So I'm going to keep an eye on the extra help thing, and well, hopefully that doesn't change. Monica, I applied for Social Security benefits on March, requested payment consideration. It is currently being reviewed and wonder when should I reach out for an update. Please advise. So you applied for Social Security retirement in March. Yeah, I've taken millions of retirement claims. I don't know about to hit a million, but anyway, hundreds and hundreds of thousands. And I've never had a retirement claim that took more than, if you provided all your documents, if you provided your U.S. citizen or your green card, your legal status, your birth certificate, if it was required, anything like that, if you provided all the documents, yeah, it should take them 5 minutes to push the button once they reviewed everything. But if I'm thinking something fell through the cracks. What probably happened is the person that took your retirement claim is no longer with the agency. They were kicked out, summarily kicked out of the agency by, or as we used to say in the Marine Corps, voluntarily told to leave. So they might not be there anymore. So it might be sitting on that person's desk and they're gone. And they're looking for someone else in the office to take over that workload, and they're already they're under mountains themselves. I would reach out. I would definitely reach out. Yeah, that doesn't sound right at all. Being in March, absolutely not. Janet, my husband and I have Medicare A, and we still work, so we carry health insurance through our employer. Should we apply for Medicare Advantage also? Now, no, doesn't sound like it. This is one of those situations where you're wasting $185. If so, you both work. Doesn't matter. One works, and as long as you both have current insurance from current work, which sounds like you both do, and your employer has 20 or more employees, then that's creditable coverage. So you do not have to sign up for Part B. You have Part A's. That means, some people go ahead and sign up for Part A. If you're receiving Social Security benefits, the monthly benefits, you have to sign up for Part A at 65. But Part B, it sounds like you did the right thing. Delay, don't sign up for Part B until you no longer have health insurance from current work. So about 2 or 3 months, you're going to lose your health insurance because you're going to stop working. Then go ahead and sign up for Part B. And then right after you sign up for Part B, contact, chapter or whoever and say, tell me about Medicare supplement plans. What is a Medicare supplement, Medigap plan? Same thing. What's the difference between N and G? And then say, okay, now what's the difference between that and a Medicare Advantage plan? So make sure you're fully informed and get all your options. And then if you choose a Medicare Advantage plan, then absolutely at that time. So whichever one is best for you. Nobody can tell you what's best for you until they start asking you a whole bunch of questions. All right, so let me see. I've got a bunch of video questions. Let's get into a couple of those. And I had a question yesterday that I wasn't able to answer. Someone asked, I always talk about, getting benefits on a, divorced spouse's record and everything. And they would say, well, I don't have that person's Social Security number, so how do I do that? You don't need the person's Social Security number. If you want to see if you're eligible for benefits on a deceased spouse or a divorced spouse, you don't need their Social Security number. You just need their name, their date of birth, as well as it, or their age, and where generally they were born. And then the Social Security person can find the Social Security number. I've done that a million times, and I've never, ever, ever not been able to find a person's Social Security number. Yeah, so pretty easy. All right, let's get into some of these, and let's see. I've got some ones from yesterday.
Hello, hi, my name is Mona. I claim zero on my W 4, and I still had to pay $1,000 come tax time. Still don't know why. And now I just added about a week ago, I added $50 to be taken out of my pay biweekly, so when tax time come, I don't owe as much money. So what I'm thinking with this new tax bill, the deduction, that I should be able to claim one, have more.
Okay, this sounds like more of a IRS type question, but um, so this is strictly income tax. But I think I was hoping she was going to get into Social Security. You can, if you want taxes withheld from your Social Security benefits because you're in a higher tax bracket or something like that. I guess not many people are going to do that nowadays because of the deduction. But anyway, but some people still want to do it. There's this thing called the voluntary tax withholding, WV tax withholding, W4V. It's a voluntary tax withholding where you can tell the Social Security Administration to take out 7%, 12%, or 25% of your Social Security. So that is an option some people use. All right, let's see what else we have here.
Is going to happen to people who are on the home and community based services waiver here in Florida and provide services to people with disabilities through Medicaid? And I'm wondering what's going to happen.
Yeah, we don't know. But the state of Florida is going to lose billions of dollars in assistance. And so this is a good program. Some states do this and some states don't. So they're in some particular states, they have programs where there's someone elderly or disabled, and normally those people would have to go to some type of facility, nursing home or something like that, and those are crazy expensive. So those states have done the smart thing. They've said, hey, we can hire someone a lot cheaper to help you out. Come by every day or a few hours a week or whatever the case may be, and help you out. So number one, you can stay in your own home, which is awesome for people. It's good for their health and their everything, and it saves the state a whole bunch of money. And so they pay people to go help you out. And in some states, they say we don't care who does it. So if you're the daughter or son or cousin or father or mother, whatever the case may be, you can apply for this program and get paid. It's a regular job. It just so happens the person you take care of is a relative. So some states have done that. It's an excellent program. People that are involved in that program, they love it, but they all know there's limited budgeting in those programs. And now the budgeting is going to be worse. So again, reach out to your politicians and say, hey, this is important. A lot of this stuff is to cutting Medicaid and cutting services like that to save $1 now, it wastes $10 later. So if you cut Medicaid to all these people, who doesn't matter who it is, whether you agree they should have it or not, doesn't matter. If they don't have health care, if they don't have health insurance, they still have health care, and their health care is called the emergency room. They'll just go to the emergency room at a critical time, and it'll cost everybody, the hospital, you, us, everything, so much more. So
Hello, I am 64 years old and I'm receiving widow survivor benefits. I'm entitled to CAPERS. If I drew it now, does it count as income towards my 1900 a month? Thank you.
no, it does not. So any type of unearned income like that does not count against your Social Security retirement, spouse benefits, surviving spouse benefits, SSDI, or anything like that. That is unearned income. So CAPERS, it sounds like it's California PERS or something. Public Employee Retirement System. So that doesn't count. That's not earned income. If you receive an SSI, which is the welfare-based program, then yes, it does count because any income coming in when you're on, the welfare needs-based program of SSI, supplemental security income, it does count. But you're on just regular retirement or disability or whatever the case may be. So no, it doesn't. It doesn't count.
Hi, I've been on Social Security for 4 years. Since I'm 62, I took early retirement. So now, since February of this year, found out that I've got congestive heart failure, and the doctor now put me on one of these, a defibrillator, in case something happens. They just records everything,
Wow.
and it will shock me if, I have a heart attack. Hope to God I don't.
Wow.
But am I going to lose all my SNAP, which is not that much? It's $100, but it's something, and my Medicaid, and I won't be able to see the doctor. What are my next steps when this bill actually? Am I going to get some kind of paper in the mail or what? Because this is really scary. I can't believe the person who's president. I really liked him until all this craziness he creates. It's just unfair, and I think it's a very cruel thing he's doing to us seniors and everybody on Medicaid who have personal problems. It's just not fair.
All right. Yeah, that's so again, we don't know what's going to happen with Medicaid, whether your particular state is going to take a preemptive strike and start cutting back on food stamps and all the rest of it, because again, this is a state-federal partnership for all of these things. States receive federal funding, and if they see that in the future they're not going to receive that federal funding, then they just might start taking, making cuts now. So reach out to your politicians, reach out to your, Department of Social Services where you get your Medicaid and food stamps and everything, and make sure you keep in the loop on that. And if you hear anything about them cutting benefits that you need to live and survive, then make sure, you do the right thing and reach out to your politicians and see what you can do. You said you're about 64 or so, and you're also going to be eligible for Medicare here pretty soon. So even if something happens to Medicaid, you're going to have Medicare here pretty soon. So because you're already receiving your Social Security benefits, it sounds like, then you don't have to go sign up for Medicare. It'll be automatic. Anybody that receives Social Security monthly benefits, once they hit 65 years old, about 3 months before they hit 65, they're automatically signed up for Medicare. And at that time, if you receive benefits and you have health insurance from work, current work, 20 more employees, yours or your spouse's, then you can just refuse Part B. You have to keep Part A, but you can refuse Part B. But in your particular case, you can't because you're going to need that. And then if you have Medicaid, remember, I would reach out to Medicaid and say, hey, I'm about to be charged this $185 for Medicare Part B. Are y'all going to hook me up and pay for that Part B, the $185? And hopefully, yeah, they will. Steve, heard about a 59-year-old lady on SSDI who takes 20 medications a day. Ouch. And is in a nursing home, received a letter from Social Security saying she could enter the workforce. What's the deal? Oh my gosh. Yeah. So it sounds as though, yeah, I'm not sure. There is on when you're on SSDI, Social Security Disability Insurance, they do a continuing disability review, a CDR, every now and then. So maybe she did her CDR, her continuing disability review. It could be a medical CDR or a work CDR if she's been working, but it sounds like it's probably a medical CDR. So yeah, maybe she didn't fill it out. If she's in a nursing home now, maybe the Social Security Administration send it to the wrong address, send the CDR package to the wrong address because she didn't update her address, or she just never got the mail or whatever. And they said, hey, since you didn't respond, then, we just might have to kick you off. So just make sure she reaches out and make sure she reaches out to Social Security and checks out what's going on with that. And then the more details on what a continuing disability review is you can go onto my website, click on the disability part right there, go down to continuing reviews, click on the continuing reviews there, and it tells you what it is, what if we'll receive it, what's the form 455, what's this. Yeah, I got tons of questions. People always have tons of questions about the CDR process. So I'm figuring that's possibly what happened. So let's see. There are great jobs that are harder to find, especially if you're over 60. There is job discrimination. Yeah, and that's going to be tough. So if they have these work requirements, if you have Medicaid and you receive Medicaid and they say, well, you have to go back to work, there is supposed to be in the bill that if you're in your particular area, if there's a really, really high unemployment rate and there's basically like no jobs, then there's an exception for that. But it's a very, very high percentage. And then the unemployment rate changes over time, and it's up and down and everything. So one day you're good, then you're not. And but up until 64, according to the new bill, if you're receiving Medicaid and you live in most parts of the country, then they're going to make you, go to work. Even if, and people say, well, then they're, if they can't work, they're on disability. So they should apply for disability from Social Security and get approved for disability. Well, guess what? Social Security disability makes mistakes, and their threshold for receiving disability is pretty high as well. So if you're on the borderline or just below and, from Social Security high standards for receiving disability benefits, but you're still not able to work, particularly 8 hours a month or whatever the case may be, and there's just, you don't have transportation to get to that one job that you can get to, and you can get the job for a month or 2 months, but you can't keep it. Yeah, it's crazy. And there have been states that have tried this, I think Georgia, and they spent, about 2 or 3 times more money monitoring people to see if they're working, 2 or 3 times what they would have paid if they just gave these people health insurance. So it's like, okay, we can give you $1 of health insurance, or we can spend $3, confirming you're working on a monthly basis and doing this reporting and building the website. And yeah, it's crazy. So it makes no sense, but it's to cut $1 now so we can spend $10 more later. Diana, it sounds like you have Medicare Advantage. You get to keep your plan and not be kicked off. Okay, so somebody's yeah, they can't kick you off a Medicare Advantage plan. So yeah, if you have a Medicare Advantage, they can't kick you off. The only thing they can kick you off Medicaid. You can't be kicked off of Medicare, original Part A, Part B. You can't be kicked off of a prescription drug plan. Well, if you don't pay your premium, I guess you will. You can be kicked off your Medicare supplement plan. The only time they can kick you off your Medicare supplement plan, the plan N or G or F, is you don't pay your premium. But Medicare Advantage, they can't kick you off. So they can change your plan, and that's what's going to happen a lot. I think next year is a lot of plans are going to be changed. So, all right, let's see what other questions. Ed, I have been searching all over for answer to when the cuts kick in, and they all agree after the midterms. Is this true? Some of the most the nastiest cuts. Yeah, that's what politicians do. They say, they give you some pennies and give you some crumbs and the $6,000 supposedly free taxes, and then Social Security sends out an illegal email saying, being political, and then you're all happy, and then you vote for the same people that just is going to make your life far more difficult. And politicians are smart like that. So but we keep getting distracted on Vic and Cindy, is it true that Social Security Form 2458 is not a document a local Social Security office is authorized to fill out and sign for a benefits recipient? We had requested this for our Panama visa application and told no. 2458, yeah, I'm not sure. Is this, oh God, I'm trying to remember what the 2458 is. But if it's for a request for a Panama visa application, Is this the form that you actually paid into Social Security and all that kind of stuff? Proof that you're actually insured for Social Security and stuff like that. Yeah, if it's an SSA form, then SSA should do it. I think I don't get those very often. I forget exactly what that form is. Let me know what the actual form name is. Thank you for this conversation. My adult daughter has special needs and she receives Medicaid and survivor benefits. She also has a community waiver from the OID. How will this affect her? Again, we don't know, but reach out to your politicians, because the federal politicians ain't there to help us. It looks like the people that are in control, they've done their thing. So we need to start going local. And after all, as they say, all politics are local anyway, right? So, all right, I've ran out of time, over an hour there. So make sure you like, subscribe, share. If you see any fallout from any of this stuff, please make a little video. I had a few more videos today I wasn't able to get to, but I will get to the other ones tomorrow. But let's look out for each other. So please take care of yourselves and take